Okay, well, welcome colleagues. It looks like we've got a critical mass of peers and partners on the call already. Welcome to the National Health Council webinar. I'm Randy Ruda, Chief Executive Officer for the National Health Council. And today's the topic is how to talk about health, the pandemic and lessons learned. Now we'll be recording today's presentation and this recording will be posted to the website. But I'm really excited to introduce to you Dr. Lisa Fitzpatrick, who has got an amazing resume. I've had an opportunity to get to know, and she is really impressive. And her presentation today, I think, is going to be extremely relevant and valuable to everybody on the call today. Dr. Fitzpatrick is a medical doctor who's also worked at the Centers for Disease Control and Prevention, and her career has spanned research, clinical medicine, global health, community health education, and patient advocacy. She recently served as the medical director for Washington, D.C.'s Medicaid program. And as a district resident, I thanked her and really appreciate that difficult job, which she did so well. She's also a clinical professor and lecturer for the George Washington University School of Medicine and the Milken Institute School of Public Health. A member of the Aspen Institute Global Leadership Network, Dr. Fitzpatrick was selected as a 2017 Aspen Institute Health Innovator Fellow. Dr. Fitzpatrick has a master's degree in public health from the University of California at Berkeley School of Public Health and has a master's degree in public health administration from the Harvard Kennedy School of Government. Following the presentation, I will do my best to facilitate your questions and comments because I think there'll be many, and I'd ask you to post them to the chat, and from there I'll invite you to come off mute and to engage our speaker and the other audience members. Dr. Fitzpatrick has said she would welcome our questions and our comments. So it is indeed my pleasure to introduce Dr. Fitzpatrick. Lisa?
Good afternoon, and thank you, Randall, for that introduction. It's nice to be here with you all today. I look forward to getting to your questions. I will spend 20 minutes or so telling you mostly what I've been focused on during the pandemic, but also helping you understand or provide some insight into Grapevine Health and Dr. Lisa on the Street. So next slide. And here's the overview. So I'll talk a little bit about health literacy. I suspect you know a fair amount about it, but just to ensure we're on the same page. And why I decided, or how I decided to address health literacy. Some of the lessons we've learned during the pandemic, specifically from our Ask the Doctor sessions, which we started specifically to address misinformation in the community and then offer some recommendations based on what we saw and heard. Next slide. So our objectives today are fairly straightforward. We will discuss approaches to communicating COVID-related scientific information and experiences addressing COVID misinformation and the evolving science around the pandemic. Next slide. So as I'm sure you know, health information can be very confusing. And I wanted to spend a few minutes just helping you understand how I arrived at my focus on health literacy. A lot of this is from my patients, my family members, people in the community asking me to help them understand health information. And this is long before the pandemic. Next slide. Some of the frustrations people have related to me are around how doctors speak in a language people don't understand. And I attended a session a couple summers ago, a community session that was hosted by local physicians. And I jotted down words I suspected the community had trouble understanding. These are words that were used by the presenters, but they did not explain. And just for kicks afterwards, I showed the list to some of the people in the audience to say, do you know any of these words? And I show this frequently just to remind people that even though those of us in the health sector are very accustomed to using this language, for many people, it's like speaking a completely different language, and we need to be mindful about how we talk about health conditions and health information in general. Next slide. So knowing this is a pretty much universal problem And also having people in the community say to me, I don't trust doctors because I don't understand what you're talking about. I thought, well, surely there's a better way for us to build trust and bridge communication with the community. So I started Dr. Lisa on the Street some years ago. And Dr. Lisa on the Street is just as it sounds, these impromptu conversations with people talking about a variety of health issues. And then because we use video to capture these moments, we can democratize the information via the internet. And I have an example of, it's a reel, a 1-minute reel, so that you get a flavor for Dr. Lisa on the Street, because it'll establish the context for some of the comments I'll make later in the presentation. So let's watch the video. Doctors often speak in a language that people don't understand. Has this ever happened to you?
Pretty much all the time.
Oh.
About the extent.
Not cooking food properly. That's salmonella.
Well, that's no.
Okay.
And I don't want one. I see everyone pushing it, and they keep pushing it, and everyone keeps pushing it. I'm sick of corporate America pushing stuff on me.
Sean got some Pop-Tarts.
Yeah.
Okay, did you just tell me that we have to cut down our sugar?
I did.
And you're diabetic,
I am.
and you have Pop-Tarts and Fruit Loops.
Yeah.
These are my kidneys alone.
You said kidneys are long?
Kidney all alone.
So that's the kidney. This is the lung.
Hospital with her one day, and she wanted to say she was pregnant, but she said, "Oh, I got a stomach ache," something like that. So it depends.
You go to the emergency room and get a physical. So do you have
Sometimes
a?
it all depends.
But how do you think we can get the message out to them?
The way you're talking to me now, each
Right.
one teach one and
Oh.
spread the news.
All right. I'm Dr. Lisa. I'll see you on the street. So this approach is I found to be a very next slide. I found to be a very engaging approach, and we have incorporated this approach into the business model for Dr. Lisa on the Street. And the idea is to create relatable, trustworthy health content that we could sell to health systems and insurance companies. So we're in early days, but it's going pretty well. But because of the wisdom we've gathered from community members and these interactions on the street, we took this into the pandemic to help improve people's understanding of the pandemic, coronavirus, and most recently, for the last several months, I would say, we have heavily been focused on vaccine literacy. In the top right photo, this is Dr. Fabian Sandoval. He is a Spanish-speaking physician who's on our team, and he's having a doctor on the street conversation in Spanish. He's talking to this woman about the vaccine. And we've interacted with people in a variety of ways, including the conversations on the street, but also social media based conversations like the Straight Talk with Dr. Lisa, and that's a Facebook show. But I want to spend time talking about the Ask the Doctor series, because I think this is where we got the most insight about how to communicate with people about misinformation and about science. The Ask the Doctor series was started because we've seen a lot of educational programs online, virtual programs, but these programs are largely experts on panels talking to people and sharing their expertise. And sometimes many of these programs allow people to write their questions. But what I noticed was that there's a disconnect between some of the questions we were getting in the community and questions people were posting on social media and the information that was being delivered through the webinars. So for example, a very common question is, well, these vaccines aren't approved. Why aren't they approved by the FDA? So this question might be answered in a very generic way during a webinar or with experts, but what people want to understand is, why should I trust a vaccine if you're telling me it's not approved by the FDA? And so there's a nuance there between the emergency use authorization and a full FDA approval we're accustomed to speaking about. So really trying to answer these questions in a very basic way and being very honest about what we do and don't know. This is the approach we've tried to take with the Ask the Doctor series. And the Ask the Doctor series is just as it sounds. So I might be on a Zoom call with 20 or 30 people, and people will unmute themselves, ask their question, and have a dialogue back and forth until their question is answered. And it's been a very effective approach for us. Next slide. The challenge we're seeing, and I love this quote because never is it more apparent than during this pandemic. It's so difficult to address misinformation. It's like playing whack-a-mole. In fact, in March 2020 and maybe even into April, I was very diligent about trying to address every piece of misinformation that came through my inbox, every question people asked me on Facebook. I did Facebook Lives trying to address the misinformation, but I just could not stay ahead of it and realized this needs a full-time operation to address misinformation consistently. So this is a very humbling truth about misinformation and disinformation. Next slide. So what are we hearing? I'm sure many of you have heard some of these things. And because most of our work is in the Black community, some of these things are, these are pieces of misinformation that we are still struggling to address. But we still hear these things. Someone said to me, "Are you still hearing about the microchips? I thought that was long gone." I heard this just last week. And most of these things I continue to hear about. The conspiracy theory with Bill Gates. Population control is also ascribed to Bill Gates. He's created these vaccines for population control. And I think part of the challenge with addressing misinformation is that we don't take the time to figure out where the misinformation is coming from and then addressing that, or helping people understand how the information may be rooted in a morsel of truth, and then somehow through the grapevine and through passing from person to person, the information becomes distorted and misinterpreted. So in the case of population control, I wanted to know, because I kept hearing this over and over again, what is this association with Bill Gates and population control? And if you Google it, you will actually see videos of Bill Gates talking about population control as a mechanism to deal with poverty in some places in Africa. And so the challenge is the information is being misconstrued and misinterpreted. And if you don't know the genesis of the conversation, then it's easy to buy into the misinformation. The early rumor about Black people not being susceptible to coronavirus, I don't know that this myth is still around, but I think we lost a lot of ground because this myth was around for so long. And it took something like a high death toll among Black and brown people before people really woke up and realized, okay, maybe this is something we should pay attention to. But I'm still hearing people tell me they don't believe COVID is real. And people are dying from things they would have died of had there been no pandemic. Sometimes we can't address everything, but we have to do our best to be honest with people. And I think I'll mention this a little bit later, but it's really important for us to let people have their say. Next slide. So what we found through these Ask the Doctor sessions and the approach on the street corner is the trusted messenger really matters. And this isn't a one-size-fits-all approach. So just because I'm a Black physician doesn't mean every Black person wants to hear from me. However, during this pandemic, it has been quite effective for many people. And I think it's worth mentioning that, because I think this translates to healthcare in general. We have a shortage of Black and brown healthcare providers. So what do we do? Maybe this is something we can talk about in the question and answer session, but we're seeing the impact of having Black doctors talk about their experiences. In my case, I was a vaccine trial participant. So I made videos and I put this online, and I offered for people to contact me if they had questions or if they were concerned about getting the vaccines. And this, I think it's a really important point for us to continue to emphasize across the health sector, because we need to ensure from the top of our organizations down to the bottom that people recognize that we need to identify who those trusted messengers are. And so I have a quote here from a colleague of mine who's actually a white male doctor, a very compassionate one, by the way, who's also passionate about health literacy. And he said a Black patient he was visiting with a Black patient, and he asked him if he wanted to get vaccinated. And the patient said to him, well, I have to do my research. And my friend says, well, I can answer any questions. We're here together. Why don't you ask me your questions? He says, well, I'm not looking for your information. I'm looking for my own information. Meaning he needed to go back and confer with people he trusted in his community about the vaccine. And this is something we hear a lot during the Ask the Doctor sessions as well. Next slide. So who are the credible messengers if not simply Black doctors for the Black community, or Latinx doctors for the Latinx community, and so on? We've asked people about this. How do you determine if you trust health information, and who should it come from? And when we talk to people about the leaders of our public health agencies, one of the most striking things is they don't understand the differences between the agencies, which probably is not a surprise. Those of us who are in healthcare, we're accustomed to listening to CDC, FDA, NIH. We understand the mission of each organization, but the public doesn't. And I can't tell you how many people have told me Dr. Fauci is the head of the CDC. And not that it matters so much that people need to understand what these agencies do. I think it is important. But in the case of misinformation and trusted messengers, I think it does matter, because we really need to develop a relationship with the public and communicate the information unique and specific to these agencies, particularly during this pandemic. I think primarily FDA, there's so many questions about the research process, how the vaccines were approved, why we have vaccines so quickly, what is an EUA versus an FDA approval. But if people don't trust or recognize the messengers who speak on behalf of the FDA, and I'm just using them as an example, but I'm raising it because I think we really have to do a better job and also hold these agencies accountable for speaking to the public and building trusted relationships with the public. So these are just the observations. I've summarized them from the Ask the Doctor sessions and also the questions or the answers we've gotten from the public. They feel very disconnected from health and science leaders. And I think this is largely because we're not honest in answering the questions, particularly things we do and don't know. We're seeing this right now with the Delta variant. People don't know what to believe. And because we don't have the information, I'm still waiting to hear from someone at Johnson & Johnson to answer my question. Why don't we know the answer to this question about the efficacy? If we know, we have some information about the other two vaccines, why don't we have it for Johnson & Johnson? And when we don't have this kind of information and we don't show a good faith effort to try and identify the answer to the questions, this also erodes trust. And I think this is impacting people's willingness to accept public health advice. Next slide. So why does all this matter? For us, it matters because trust is the currency we value at Grapevine Health. These are quotes from people in the community. And I take time to share these widely because I think we don't think enough about the impact of our messages, whether they're written messages, whether they're video messages, or even face-to-face interactions we have with people. So if I can't understand you, I don't trust you. A homeless gentleman said this to me when I said to him, why don't you keep your clinic visits? He said, because doctors use big words and I don't understand what they're talking about. I've had this statement I've had people say this to me over and over and over again. Why should I believe the scientists when every 5 minutes they change the story? We're hearing this a lot during the pandemic. Understandable. This one's hard to swallow. Doctors are nothing but drug dealers working for drug companies. I think this is a very uncomfortable topic, but we have to find ways to have a conversation with the community about this. How does the health system work? Why do medications cost so much? Why are we constantly changing medications? One of my neighbors who gives me lots of insight to understand why the community doesn't always trust the health system. He says, every time I go to the doctor, they write a new prescription, but I have medicine stacked up in my house. Why are they still giving me new prescriptions? And he thinks it's not for his benefit, but for ours. And then finally, people just want us to give them straight information. And this feeds into when we use big words like myocarditis, pericarditis. These are the ones that are on the top of mind for me because I was reviewing a video, a doctor talking about the side effects from one of the vaccines. And he said, well, myocarditis and pericarditis, but he does not explain what those terms mean. This erodes trust. And this is what people mean when they say, well, just be straight with me. Next slide. Next slide. So what have we learned from our outreach during the pandemic? And what doesn't work is judgment and shaming. And this could be number 1, 2, and 3. So I think the tendency is to try and help people understand why they should do something and talk about how rational it is to make a decision. So the notion that people should get vaccinated because Black people are dying, and why wouldn't you want to protect your family and protect your community? This can often come across as judgment and shaming. And we heard this over and over and over again. People don't want us to tell them what to do. They want us to trust that they have enough ability to make a decision. They want us to give them the information, demystify the information, and let them make a decision. I think some of the tactics we're using right now around incentives for the vaccines, we're hearing that for some people, this is backfiring because they feel these tactics are coercive. So why are you offering me these things to take the vaccine? And people always want to feel as if they have a choice. So they're saying, well, I don't really want your incentive I want you to tell me what's in the vaccine and what's going to happen 10 years from now. Even though we can't give them those assurances, those are the kinds of questions they're asking us. These are mostly the people who continue to be vaccine hesitant. And then finally, the scare tactics, these aren't working. I have been interviewing people for the last few days, asking them if they care about the Delta variant. And the majority of them have either not heard of it or they're not concerned. And I think largely it's because we've been talking about variants for a long time and they're not feeling the impact of the variants. Next slide. So what can we do? I think our biggest challenge right now is to build trust and either gain credibility or remain credible with the public. And so how do we do that? I think the different ways we communicate, maybe within your organization, something for you to think about, the people you're trying to reach. Can people see themselves represented in your information, your health information, whether it's the language you use or the images in your pamphlets, on your website, even if you have programs for people, is there representation there? And I would also encourage you to think about whether or not you can integrate community members in your programming. Because the other thing we've noticed with allowing the member of the public to be in the program, so asking their own question rather than having someone speak on their behalf, that gives them a sense of agency or a sense of ownership. And it's something to consider for your programs as well, even if they're only there to ask questions of experts. I think I talked quite a bit already about bridging trust and credibility through language, but is the language appropriate? And I think this is something you'll have to fine tune over time. Do you have a mechanism to get feedback from the community about your messaging? Is there a way for you to listen to what their concerns are and then respond to what they have to say? And then finally, I mentioned this a few times already, we have to be honest about what we know and what we don't know. And I think the example of the EUA is still a great example, because in trying to help people understand the difference between an EUA and an approval, a formal approval, there's a nuance there I think the public may not get. And I've tried to explain this by saying a full FDA approval requires a set of steps we couldn't necessarily do during the pandemic. One of those steps is a visit to the lab, a site visit. So a gang of people would have to go into the lab. And we know this is a time we're trying to minimize people being in close spaces together indoors. And so for some people that works, and other people, they're still skeptical. But I think, again, just having the dialogue to try and really fine tune what is the issue that is creating a confusion for people or distrust. And then finally, the conspiracy theories, they will always be with us. A large part of my career, I worked in HIV. And in so many ways, this COVID-19 pandemic has paralleled my experience in HIV around the distrust, around the lack of engagement or trust in research and science, the stigma associated with it. And so the conspiracy theories, I think, are something we have to acknowledge. We don't have to accept them. But the minute we shut down the conspiracy theory without letting the person have their say, I think they can't hear anything else I say if I choose not to listen. I don't have to accept it. So I think there's a nuance to the communication, particularly when you're entertaining someone's conspiracy theory. Because the truth is, some things we'll never be able to prove. People keep asking me about whether or not coronavirus, SARS-CoV-2, was made in a lab. I actually think that's probably going to be ultimately unknowable. And so there's no way for me to say with 100% certainty that's not true. And so I think just acknowledging that and then moving on really gains you some credibility and allows you to have conversation with people. I think that's my last slide. Is there another slide? Yes, that was my last slide. So I just wanted to give you a flavor for what we've been doing during the pandemic, some of the things we're hearing, but I'm actually much more eager to hear your questions and your experiences. So thank you for listening.
Dr. Lisa, that was great. And I really like the video and those images that you have of you out in the community, talking to people who have real questions and have real decisions to make that are going to affect their lives, their families' lives. So that was really good insights. And I know I have a few questions I jotted down for you, but I will go to our chat because Autumn Fink had a question that she raised about keeping it simple and talking about the different manufacturers of the various vaccines. Autumn, why don't you go ahead and phrase your question for Dr. Lisa?
Nice.
Hi, can you hear me?
Yes.
Yeah.
Okay, sorry, I'm on my work desktop. So I brought that up because I feel like when the J&J came up with like the blood clots that were happening in some of the cases, like I know a lot of my family, they just were like not wanting to get it, and my friends were scared, and like trying to explain like, no, that was for this vaccine, this is not, they're not all the same. Like I just feel like I could have done a better job at keeping that simple. And like you said, like the health literacy has definitely came up a lot with COVID. So how would you go about explaining the difference between J&J and Moderna, even like just something simple I could use?
So first of all, thank you for trying to help people understand. And I just want to remind everybody that it's hard to be a prophet in your own land. And so sometimes if you're trying to talk to your family or people who are very close to you, you might refer them to someone else and the message might get through a little better. But in this case, I think just starting with helping people to understand that there are different ways to make vaccines and to ensure they understand how a vaccine works and why we need vaccines. And the purpose of a vaccine is to show your body the germ to protect you in case you encounter the real thing, or there are different metaphors for vaccines. And then in saying, well, the Johnson & Johnson is different than Moderna and Pfizer because it just uses a different mechanism to do the same thing. And it just so happens that this vaccine is one shot and these other vaccines are 2 shots. And we have other examples of that. So for instance, the hepatitis B vaccine is 3 shots, whereas, you know, there's another vaccine, you get a flu shot once a year. So I think this is all very complex information. And I think for the first time, the general public is really paying attention on a level we've always wanted, but we weren't quite ready for. So I think starting as basic as you can and just answering the questions using metaphors and examples that are not necessarily related to healthcare to help get the message across. But I also think there are some pretty good video explainers out there. So, you know, and I know it's hard to identify the misinformation and disinformation on some of the YouTube videos. I know that's been a huge problem. But for things like this, to explain the science, the sort of pathophysiology and the science of how things work, I think the YouTube videos have actually been pretty good for that.
Thank you.
That's great. And actually, Julie has a question that's interesting as well, slightly different perspective, and that is, you know, physician preparation and their own training around health literacy. Julie, do you want to go ahead and just state that question?
Sure. Thanks for the opportunity and thanks for the great presentation, Dr. Fitzpatrick. And just hearing you provide your answer to Autumn and how you explain the pathophysiology behind the science, it just kind of is an example of what kind of training are all types of healthcare providers getting on health literacy, and how do we infuse that into training? What can we do to help with this?
This is an excellent question. Thank you so much. I think the quick, easy answer is that it's actually not integrated consistently in medical training. I think in health sciences, period. What you can do is to advocate and lobby for it. I think storytelling is very effective here. So if you encounter clients, customers, constituents who maybe have been the victim of a medical error because they didn't understand something, or maybe there's a high cost situation associated with low health literacy. So someone not really understanding their health condition. I think telling those stories to convey why it's so important and why the onus is actually on us to ensure people understand this. The example I like to use that really seems to resonate with people is the dialysis patient who skips dialysis. Dialysis can be a drag. And, this gentleman had people coming from out of town and they wanted to throw him a barbecue. And he thought, well, it's not that big a deal. I'll skip my dialysis, hang out with my friends, and then I'll just go and get my dialysis when they leave. Well, he ended up in the ICU. So I think stories like that can help convey the importance of emphasizing and prioritizing health literacy. But I think we all need to play a role, because right now it doesn't seem to get the priority it needs. I've done quite a bit of writing on this, why health literacy should be considered a social driver of health, for example. And why are we prioritizing food and transportation and not health literacy? Helping people understand how to be healthy, how to keep themselves safe. Those are the things we really need to emphasize and focus on. But I think that in general, people think, well, health literacy, that's just information. So why can't people just Google it? Which is also problematic. So I would appreciate any help from any of you to advocate for resources and for prioritizing this in allied health science education.
Well, we're all in. The National Health Council, is a strong advocate for medical training, just clinical training across all of the different, areas of practice on health literacy, and the ability of those trusted clinicians to be able to speak honestly, openly, in a way that's trusted, with their patients. We all want that same thing. But then you have to look at scheduling and how are people, put in a clinical environment and what time and opportunity they have to engage with people. So it really is a dialogue worth having kind of systemically. And that is something that's really important to us. I'm curious, we as a National Health Council, as you might imagine, have made a commitment, particularly, certainly preceded, but particularly with the pandemic, that shed such a harsh light on how our healthcare ecosystem is failing so many communities within the patient population. Black communities, brown communities, LGBTQ communities, and others, maybe even just rural residents, have just not been well served. And so we've been really working to try to close those gaps. We have an equity initiative. We continue to look at disparities. Talk a little bit about that intersection between health literacy and closing some of those disparity gaps. I think, and you've touched on that, I think, already, but how are those, in my mind, so closely connected?
Yeah, well, I think we don't talk enough about background literacy, because while health literacy is a universal issue, there are plenty of data to demonstrate that if you have low background literacy, you are more likely to have poor health outcomes or worse health outcomes. You're at higher risk for death and so on. So I think just acknowledging that and also finding ways to incorporate that into the data we collect and to the clinical care we provide. We have tools for health literacy. I think along these lines, we could use your help in figuring out how to prioritize measures, better measures of health literacy. measures that can help us identify the link. We need strong links between not understanding something and having a poor health outcome, or costing the health system a lot of money. Are there savings opportunities? I know there are, but because we aren't systematically documenting these things, it's very difficult. But I think they're all interrelated. And so while it's easy for us to say, okay, more Black and brown people died of X condition, the answer to your question is in the why and the how. Like, why did that happen? What were the intervening circumstances, or were there variables we should have been considering? I think these are all data points we need to coalesce around so that we can identify better ways to measure, so that we're all talking about the same thing. This is something I'm talking a lot about now when everybody's talking about health equity. Right. Are we all talking about the same thing when we say health equity? How will we know if we're moving in the right direction? How will we know if we get there, if we don't have and agree on the measures, what we're talking about? So I think that there is definitely a connection, but we need to be more granular and more specific with it. I think an organization like yours could certainly help us get there as a thought leader.
I really appreciate that. So we'll consider that a call to action for us to circle back to and really explore that further. One of the things that the National Health Council and many of our individual members do is research. And it's always going to be very patient-centered, very, responsive to individuals, their interests, their viewpoints, their needs, in their voice. And I think that will go a long way to helping us then really find solutions that are going to be effective. So count us in on measures and things. We're there for you.
Yeah, and I just want to register the challenge with the current instruments we talk about, the realm and the TOEFL. These are instruments that basically ask people to read words, and we decide if they can say the word, then that's a measure of their health literacy. But actually, those are not the best measures. And so are there different kinds of measures, like, how is adherence, whether or not you take your medicine or not? How is that linked to, is there a measure there linked to health literacy? Medication errors, is that a health literacy issue? So I think the sky is very blue when it comes to figuring out these things.
Well, it is. And thank you for pointing that out. And again, that's an area of expertise, I think, at the National Health Council, its members. Let's leverage that. And I think we've got a real sense of momentum to do so. I know my colleague, Susan Gaffney, had a question for you. Susan, why don't you go ahead and share that with Dr. Lisa?
Thanks so much for the information today. It's wonderful. I'm a big proponent of increasing health literacy, and I was wondering, with the distrust that we see among many adults, which I think you've laid a great foundation for why that is, are you seeing a compounding effect now that vaccination has opened up to kids? And how is that? Is there like a cascading effect on the vaccination rates, and what can we do to help parents? Because I think some of the things that parents are fearful about are different than what the adults are fearful about with the vaccines. And have you seen that? And do you have any advice on that?
Yeah, I have seen that a bit. We actually created a video for one of our customers 2 weeks ago asking this question. And a gentleman said to me, well, I got vaccinated, but I'm not giving it to my kid. And I said, well, why not? He said, well, because it's not FDA approved. So I mean, I'm responsible. I want to make sure, I'm willing to
I'll take the risk for myself.
Yes, but I'm not for exactly. And so I think people are all over the board on this, because the same day we saw people who were trying to figure out, how do I get my 11-year-old vaccinated?
Right.
So, and I think a lot of this is really what you see, the philosophy of the parent most of the time trickles down to their philosophy about their child. But in some cases, there is a disconnect. So I don't have any good answers for that. I think we have a situation here that's very unique. So these vaccines were communicated about by politicians before they were available. And I think we are forever going to suffer from the missteps associated with that, because they will always be shrouded in some distrust because of the way they were communicated about from the beginning. And the second thing is, we were told by some of our trusted messengers that it wasn't possible to have a vaccine in less than a year, and then we did. So people are left to wonder, what do we do with that? I thought you said, and then compound that with how the data keep changing. And because we have to evolve with the data, and the public, for the first time, they're paying attention and trying to follow along, but they can't, because it's just a lot of overwhelming, complex information that's been communicated in so many different ways. So I don't know that there's, one way to address this. I think you just have to do the best you can.
Don't give up. Yeah.
We cannot give up, because I think people are just hungry for information.
Yeah.
And so I like to ask why, so, well, why do you think that? Oh, and so why? And if you keep asking why, then maybe they'll start asking why. And we've seen that also move people. Again, just avoid telling them what to do, and I think you'll have success.
I like that, to keep asking why. Thank you.
That's really great advice. So many of our National Health Council members have patient educators, peer-to-peer support programs. They've been really robust and responsive to the pandemic in inviting people within their communities to engage, ask questions, tell stories, share fears, share successes. And it's not just about, COVID-19, that the pandemic has been so disruptive to so many people in terms of pursuing, you mentioned dialysis, just pursuing their infusions, their visits to the doctor's office, diagnostics, that having this insight that I think very much applies to the programs and resources we have within our organizations is very, very valuable. I have one question for you, because we've talked about, health literacy, and it's pretty broad the way you're describing it. A lot of focus. I saw that body diagram where you're asking people to point out various organs and things. But how often are you finding that there's a clinical component, the medical component about someone's health, but then sometimes their questions really relate to the system? Do they have health insurance? Does their health insurance plan cover the particular treatment or medicine? Is there a copay or cost sharing that may or may not be affordable to them? Clearly, with your background, certainly in the district with Medicaid, how, on the fence people are about household, expenses, their own personal health expenses, what they can afford. You mentioned training for doctors, and it may or may not go as far as it might in terms of health literacy. But what happens when it puts some of your doctors in a position of trying to interpret what the environment is around that patient relative to insurance coverage or other factors?
Yeah, this is another area in which we're failing to educate the messengers, because before taking a leadership role at a Medicaid program or an insurance company, I couldn't advise my patients about insurance. I didn't know how it worked either. At very basic level, I could say, well, maybe you have a copay, but ultimately I would just say you need to call your insurance company and ask them. So I think we are woefully unprepared as healthcare providers to help counsel people about their insurance, because we don't understand it either. And I think this is an area of opportunity and interest to help providers understand these things as well. It's not something that's taught, at least, well, I graduated from medical school 30 years ago, but I as someone who teaches in a medical school now, we actually don't spend a lot of time on these types of things, helping students understand this, but it's certainly an area where we need a lot of improvement. And I think maybe there are some medical schools now that realize the importance of this, like the administrative side of medicine. We need to teach students these things. But I would say across the board, we're really failing at this. Is this also an area you all could help?
It absolutely is. I'm making notes here. So we're taking assignments, and I couldn't be more delighted about that. Yeah, let's absolutely plan to follow up and partner with you on how we really bring lessons learned from, Dr. Lisa on the streets, from Grapevine, to really the broader National Health Council community. Because like so many of your messengers, people that are associated with our organizations are absolutely trusted. They are considered to be an essential part of making decisions around someone's health. And the more effective we can be in really meeting the person where they are, asking why, giving them the tools and information they need to make that decision in their own way is going to make us all better, and really help promote health. So thank you so much for that. I had to smile. I saw you looking through that gentleman's grocery bag and pulling out Pop-Tarts and cereal. How that reminds me of shopping with my mother, who is borderline diabetic and all these kinds of things. And yet it's like, what's all the treats in your shopping bag today? And you just don't want to be the wet blanket on someone's excitement about their shopping experience. But it creates an opportunity to say, let's look at that label and see just how far you're setting yourself up.
No. Well, but I also think approaching it with some humility. I mean, sometimes I can have these conversations because I have the same problem. Like, I love Snickers bars.
Aha. You've heard
So
it
I
here.
can talk about, my own issues. Like, I don't exercise as much as I need to. It's, these are human conditions.
Right.
And, the health system is so hierarchical and patriarchal, right?
Yes.
So anything we can do to improve access by showing a little humility or humanness, I also think opens the door to have some of these difficult conversations with people.
Absolutely. Well, thank you so much for your time today. Not just your presentation, but your example. I mean, what you're doing in your career and in this work really is motivating for all of us. So let's consider ourselves to be even more so partners going forward. Let's solve some of these problems together, and then we can celebrate maybe with a Snickers bar or two after a trip to the gym, of course, if we can make some real progress. So thank you so much for that.
Thank you. I would love that. So appreciate you having me here. And thank you all for your work as well.
Thank you. And I'll just say before we close, for those on the call, we are planning some upcoming webinars on this topic. We've got 3 public webinars on health literacy that are coming up. They'll build on and reflect, I think, much of what Dr. Lisa has shared with us today. These are going to be National Health Council member only workshops. So you see the dates there on the screen: September 24th, October 1st, October 7th. So we'd really encourage you to be involved in really taking stock of what Dr. Lisa Fitzpatrick shared with us today. Lessons learned from her work literally on the streets with members of a community that we care so much about. Let's participate in these webinars. Let's build into all of our solution strategies, whether it's on equity, whether it's around health evaluation assessments, whether it's on any aspect of measurement and metrics that we're so good at. Let's make sure that health literacy becomes an active part of our agenda in that space. I think we can make a real difference here, and I think it will pay dividends for individuals, their families, their communities, and also for the healthcare ecosystem itself. So thank you all for being part of this afternoon's workshop, and I'll look forward to talking to you next time. Take care.